spring. So thank you for helping out.
Of course.
Hello, and welcome to another live broadcast with MedStar Health. Today, we're discussing achieving optimal athletic performance with sports cardiologist, Dr. Aubrey Grant, and primary care sports medicine physician, Dr. Matthew Sedgley. Welcome to both of you, and thank you for joining us.
Thank you for having us. Glad to be here to talk about this. This is an awesome topic.
Same here. Good to see everybody.
Thank you very much. Before we get to know our experts, we want to thank our viewers for joining us today. Give us a like, let us know you're watching, and if you have any questions for our experts, ask them in the comments. Now, let's get to know our experts. Can each of you tell us a little bit about yourself, your background, and what your specialty entails? I'll start with you, Dr. Grant.
So thank you. Glad to be here today. I'm Aubrey Grant. I'm a clinical sports cardiologist. I direct the sport and performance cardiovascular program here at MedStar Health. My practice here is at the Union Memorial Hospital, where we have a beautiful cardiopulmonary exercise lab. And I also have an outpatient outpost at the Lafayette Center down in DC. I love sports. I love talking about sports. I have the fortunate opportunity to help out with the Baltimore Ravens, with the Baltimore Orioles, the Washington Capitals. And so I'm really enjoying, how MedStar's relationship has allowed me to ingratiate myself with the sort of professional landscape in the DMV area. I'm originally from Maryland. I grew up in the suburbs of Prince George's County. I've always been interested in sports. I went to DeMatha High School, where I played soccer and baseball there, played some soccer in college at Davidson. And so sports has really always been in my blood. And it's always been a really sort of great space for me to learn about teamwork, learn how to, communicate with people, and really sort of, invest myself in humanity. So I really, I'm loving the opportunity that I have to direct the sports cardiology program here. Sports cardiology in itself is a beautiful field. We take care of a lot of high-level athletes, but even, the master's level athlete and from the community level. So, cardiology really, supports sports, and, the cardiovascular function is really, really, the driving force for a lot of the performance that we have in our athletes. And so I really have loving the opportunity to be able to support, our community, our athletes, and our professionals, at this level. So.
Great. Thank you so much. And Dr. Sedgley, why don't you introduce yourself?
I always like to say I'm with that guy. He's amazing, right? So I'm double boarded in family medicine and sports medicine, and done volleyball and basketball and track in high school, and went to UMBC locally and University of Maryland for med school. So I'm kind of the local guy, and I've been a team doctor of various colleges and universities. In the past was with Stevenson University and UMBC, and now I'm one of the team doctors for Coppin State University, and I work with the Baltimore Orioles as one of their team doctors. We covering the last two games. I can tell you we swept the Twins. So love working with the high schools, recreational athletes. I also teach with the U.S. military at Fort Belvoir with some of their medical teams that work with the special forces. So everything from a weekend warrior all the way up to, I think, is some pretty superb level athletes. We like to work with them to maximize their performance in athletics. And so if you have a question or you want to ask, I think you got yourself some resources here today, and I'm super happy to be here to help you out.
Yes, thank you so much. You both have such unique specialties. Thank you so much for joining us. We have some great questions for you that we're going to get into now. As we know, spring is officially here, and people have been indoors throughout the winter and perhaps taking it easy throughout the winter season, and they're ready to get back out there and get back on track. So as people prepare for a new sport, or if they're training for a marathon, or just amping up their workout regimen, or just want to be more active, when is the best time to see you? Dr. Sedgley, I'll start with you.
Well, I'll tell you, for most of us, we want people to be active. And so we don't want it to be a barrier for you to get physical activity. We know that when we look at physical activity, it's so good for us. Lower, if you're like me, you might be slightly overweight in your 50s and maybe a former athlete at a higher level. I want you getting out there and doing stuff. So you don't have to see a doctor per se unless you have problems. Now, if you're with, Orioles, Ravens, you may have to go see Dr. Grant for a pre-participation physical. If you're a high school kid, you're probably going to need that pre-participation physical. But if you want to get out and be active, we don't want that to be a barrier. If you look at the American College of Sports Medicine, it used to be in the old days, they're like, go check out your heart. And if you don't feel any problems, we want you to be active. And that can be as simple as walking or exercising in a vigorous way for 150 minutes a week. That's it. That's all you need to do to live longer, be healthier. Weight lift twice a week for 45 minutes. Very doable. So when we look at being physically active, I don't want to put a barrier between you and being healthy. Now, you have yourself an injury, you have a symptom, chest pain, shortness of breath, or maybe you have a strong family history of cardiovascular problems. That's why we're here. We want to be available for you. But we think that there shouldn't be like ways to exclude people from being active. So, Dr. AJ, what do you think? How did I do on that one?
No, you did perfectly, to be honest. I think about my practice, to be honest, and there is room for athletes of all levels, in a sports cardiology practice. As I think about the heart in particular, and to think about the body as a whole, I think about the body as a machine, and the heart is really sort of central to that machine. The heart pumps the blood to your muscles, so your muscles can use that oxygen to create energy, and then the energy is then spouted out as acid, and your lungs sort of pump, you breathe it all out and expel that, and so that machine works in unison to create the performance that we see in our athletes. And everyone has one of these machines, and a sports cardiologist in particular can really help fine tune some of these particular aspects of the machine so that you can perform and achieve, at your best, put your best foot forward from that. And so, from my practice, I see athletes all the way up from, 15 years of age, high school level athletes. I certainly see collegiate level athletes. I see, people that have finished college and are still liking to remain active. We certainly see a bunch of endurance athletes, people who are running marathons, ultras, bicycle races, all these sorts of things. And we even see masters athletes as well. I saw a top 10 Pelotoner in my clinic last week who was in the 60s years of age. And so, the range of people that I think that we can provide value to, in a highly focused sports practice, I think is quite broad. We have a lot of unique testing available to us at the MedStar Sport and Performance Program that can really help to aid a lot of these athletes to be able to continue to remain as active as possible, as you said, Matt.
Hey, Karen, I'll tell you, I'm the medical director for running medicine. So that means every single 5K, 10K, half marathon, the Baltimore Running Festival, the Annapolis Running Festival. We have about 12 races within MedStar Health. We're the doctors at the finish line, but we see folks before, during, and after the race. And so I think, people, I don't want to necessarily have to see them on race day at the finish line tent when I'm volunteering. So we love seeing people before if there's an issue. But if I think about getting out there and just participating, there's kind of two groups. I almost have like a barbell effect. There's a bunch of people who need to be healthy. They know it. They want to be active. So I don't want to put a barrier to them getting out there and helping themselves to a good, healthy dose of exercise. And then I've got a group of elite athletes. I work with one person who holds the fastest known time running the C&O Canal. He ran the entire boundary stones of Washington, D.C., and he runs at least 2 marathons a month. He's a very elite athlete. Dr. Grant knows what I'm talking about. He's my age, he's 50, but everything's dialed in: nutrition, sleep, hydration. To do 2 marathons a month for most people would be pretty immense, but that's his baseline. So we have those level athletes, which we work with as well. And I think there's some core principles for both, but we also take a look at what are the individual needs. And if you just want to lower your cholesterol or lower your blood pressure, or you're like me and you want to look a little thinner, that's fine. We can do that. If you want to get your minute time down to a 4-minute mile because you're an elite athlete, we have the ability to look at all those details for you. So I think that it's a robust menu of things we can help runners with.
You bring up a really good point about running and endurance medicine. And I think, as the field of sports cardiology has grown and we've learned more about athleticism and its effect on the heart, over the last, decade or so, we sort of realized that even being an endurance high level athlete, even running, a couple marathons a month, it doesn't necessarily negate all of the potential risk of having cardiovascular disease. And then in particular, sometimes we see a phenomena where, a patient will come to me and they might say, I've had high cholesterol for some time, but, I've gotten the medical advice that I don't need to worry about it because I'm really active. And that's not necessarily the best way to think about these things. So we recognize people's athleticism, we recognize their endurance and people's desire to compete, all while trying to maintain activity as safe as possible. And so we really, in my practice, I try to think about longevity as well, because I want people to be as active as possible for as long as possible. So we give a lot of credence and guidance about how to do this at a high level for as long period of time.
That is great. And it's important as your patient, for your patients to listen to their own body as well, which is a good segue to my next question. Can you talk about, Dr. Grant, I'll start with you. Can you talk about what are some of the, what do athletes need to look for? Some of the, any signs that they should be keeping an eye out for, or what recommendations do you have for monitoring so someone knows when they should come see a sports cardiologist?
What I have learned and noticed in my practice of taking care of athletes for this time is that athletes tend to be really in tune with their body, and they're usually really locked in. And one of the things that I really focus on is that people know themselves, and oftentimes they'll come in and say, something just doesn't really feel right. One of the classic symptoms that I see, a lot of my athletes are really into data, and they time themselves, they have their mile times, et cetera, and they're saying, I'm putting in the work, but my mile time isn't really changing as much as it typically would with this amount of work that I'm doing. And so for me as a sports cardiologist, that's a big trigger that perhaps we need to investigate. Some more classic symptoms, chest pain, shortness of breath, lightheadedness, dizziness, these can be signs of underlying disease. Things that we commonly look for are coronary artery disease. In our masters athletes, that tends to be, one of the larger issues that we look at. We look for blockages in the heart arteries. We look for other things like arrhythmias, which means that your heart is not in the normal rhythm. Or oftentimes we are taking care of patients that have frank heart failure, meaning the pumping function of the heart is a little bit weakened, and that can cause an amalgamation of symptoms in its own. But for me, my biggest takeaway is we listen to our athletes and we really sort of trust, because athletes tend to understand and be really in tune with their bodies.
Thank you very much. And Dr. Sedgley, from your perspective, what would you say to your patients about listening to their bodies? What symptoms should they be looking out for?
Yes. So Dr. Grant, he's looking at it from the cardiovascular perspective. A lot of the injuries I see, they're not all heart related or cardiovascular related. We have folks who will do too much, too fast, too soon. So a lot of the sports that are running or have running in them, like soccer, lacrosse, basketball, field hockey, et cetera, they will get a typical, I don't want to say it's everything you see, but, shin splints, stress fractures, runner's knee, IT band syndrome. We end up seeing a lot of very common things, whether that is like plantar fasciitis. And because of that, people may be running or doing their sport, have some pain. I think if you have a little bit of pain, people are going to probably try to work through that, for a little bit. But if pain's not going away, or it's making your performance dip, that's your body having a conversation with you. You got to listen to that. And so, if I have shin pain, maybe I just had a bad day. Maybe I fell on the trail, I'm hiking or something. But if I'm consistently having pain and it's getting worse as I do more and more volume, that's something where I want to have that checked out. And certainly I think that there's a balance. People always say, well, I'm going to go out and sign up for the Baltimore, marathon. Great. Are we training for that appropriately? Are we having a nice baseline of, running and then having a slow increase? There are people who can get away with not training very much, but most people will get an injury. So I think that, that is where we like to step in and say, okay, what is the injury? And then what do we do to make you better? But then how do we return you to sport as a sports doctor in a safe fashion, so this isn't a merry-go-round of yet another injury? So that's kind of my perspective on it. The things I see are sometimes more musculoskeletal in nature, maybe more soft tissue. The good news is very few of them require surgery often, but it can be kind of painful when you hear you can't exercise after you just started exercising. So how you how you get into that's important.
All right. Yep. Thank you very much. Let's talk about the key differences between an athlete and an average person. When we think about the differences between the two, these can play a major role in how symptoms can present and how athlete can have a different course of treatment, or there might be a different recommendation for an athlete versus an average person. And we mentioned how athletes are very in tune with their bodies. That may come into play as well. Dr. Sedgley, what's the difference between an average person's joint or muscle pain compared to an athlete's, and how would treatment be different?
So the unpopular opinion for the hour is going to be often not much, right? So if I blow out my ACL, or I am the starting quarterback for the Ravens, I blow out my ACL, the treatment that you're going to get at MedStar is actually the same, which is kind of cool. That Karen, you go out and you blow your ACL out today, you're going to get like top tier 1 care, which I think is kind of good. We can treat everyone equally. But I would say, there's often the expectation like, well, is there a special rub or a salve or a treatment plan? You may have more resources at the elite level, getting second or third opinions, things like this. But the human body is really quite universal. And so I like to tell my patients that, if you're high schooler here that I'm treating it from Baltimore City, I can guarantee you, I can get you the same doctors that my professional athletes who make hundreds of millions of dollars see. And I love that. So that's like one of the great things about MedStar Health is we have such great resources. Now, I think that if you look at an elite athlete, they probably have some characteristics that make them elite. They have a higher level of resiliency, and maybe they don't feel pain as much as I would if I were to go try a marathon. It's certainly going to be faster. So I think that there are characteristics that go to that elite nature. But as far as the injury itself, we can predict with human cells how long it takes to heal. My general sense is, interestingly, sometimes your elite athletes, your professional athletes have so many voices talking to them that can put them at risk sometimes. And your job, as the doctor, is to say, hey, here's what we know for the science. If you can listen, get all the data you want. I love Dr. Google it up. Let's talk. What'd you find? But in the end, let's streamline all that data, synthesize it, and come out with a plan we're going to execute for you to get well. And more often than not, you'll see that whether it's non-operative or operative care for an injury, there's a congruence there. It's not like treatment is one way for some folks than another. And I love that fact about sports medicine. We can treat people the same, and that's great.
That is great. Thank you so much. Dr. Grant, what about from the heart perspective? How do athletes' hearts differ from other hearts? And can you explain the term athlete's heart? How does having athlete's heart potentially change your recommendation for treatment?
That's an awesome question, Karen, and I'm happy to do that. But before I do, I'm going to give a little bit of, a biology primer. So when we think about, creating energy in our body, there's kind of two main ways we can do that. We can do that aerobically, where we're using oxygen, and it's kind of an easy cycle. If you and I were just going for a light jog, we'd be using our aerobic metabolism. And then there's another way to make energy, and that's sort of anaerobic metabolism. And so if we were doing our high intensity interval training, we're going out for a sprint, we'd be more doing some anaerobic activity. And so we recognize, in that anaerobic space where, we're getting acidotic, there's creation of lactic acid, and also sometimes stress hormones can be released as we're doing that level of activity. So things like norepinephrine, epinephrine, your stress hormones, which in some instances can actually increase risk for cardiovascular events to happen. And so as we think about our high level athletes, they're doing a lot of this aerobic activity, but also they're doing a lot of this anaerobic activity as well. And so if we look at some data, we look at marathons in particular. So if you're looking at a course of a marathon, if you separate it into quartiles, sometimes cardiovascular events can happen during marathon races, and it tends to happen in that last quartile of the race, because what we think is that, as you're tiring out, as you're tuckering out, as you see the finish line right in front of you, people are busting past their aerobic metabolism to anaerobic metabolism. The stress hormones are going crazy. And if they have the sort of phenotype for, things like coronary artery disease or, other cardiac issues, that could be sort of a recipe for a cardiac event to happen. And so as a sports cardiologist, we think think about that biochemistry, that biology, and understand what the sport that the athlete is currently trying to participate in. And then we put that into reference frame for what the athlete's heart actually looks like. And so, we always are considering, what level of activity is this person trying to compete in? What does their heart actually look like? And then we try to make decisions about how to do that in the safest way possible. The term athlete's heart is a really cool term, but it's a little bit challenging to try to explain, to be honest. And so, similarly, if I'm going to the gym and I'm pumping iron and I'm lifting weights, if I'm putting a lot of, work on my bicep, my bicep tends to get a little bit bigger, and it tends to be able to adapt to that amount of work that I'm requiring from it when I'm lifting that weight. And similarly, for a heart perspective, if you're an endurance athlete and you're putting a lot of volume through your heart will grow and to be able to adapt to, adjust to be able to, handle all the volume that is putting into the heart. And so if you're doing this over chronic and long periods of time, you can actually see these changes on things like echocardiogram or cardiac MRI. And sometimes it can look like maybe there's something going on, but actually, if you look a little bit deeper and you look a little bit into the nuance of, the heart mechanics, it's actually just changes related to, exercise physiology. And so as a sports cardiologist, we're particularly trained to be able to decipher between what are the actual pathology, what are actual cardiac disease, and what's just sort of remodeling from, high level activity. And so, that's a beautiful part about my job, because I'm able to see all of this adaptation that athletes are able to create from commitment to sport. But also, we take that lens and we're able to differentiate that from sometimes true pathology. I'll provide some examples. I oftentimes am seeing patients as a second opinion. They're their cardiologists, not trained in sports, may have been holding them out because they might have some abnormality, maybe on EKG or maybe on echocardiogram. But if we look a little bit deeper, or maybe we'll do an exercise test, we'll see that they're really, really fit. And we're able to determine that their changes that they're seeing, their quote unquote abnormalities, are really just related to exercise remodeling.
Okay, thank you very much. That was a very thorough, detailed response. No, I that was really, really good. Thank you so much. I want to take a moment now to welcome our viewers again. Thank you for joining us. Today, we're discussing achieving optimal athletic performance with sports cardiologist, Dr. Aubrey Grant, and primary care sports medicine physician, Dr. Matthew Sedgley. And as the weather's getting nicer and we're preparing for outdoor sports, many people are getting ready to start new workout regimens and joining sports teams, training for upcoming races. So we're talking today about all athletes, from the weekend warrior, the seasoned athletes, to those that are just getting out there and getting started. So we've had a lot of wonderful conversations so far about listening to your body, the best time to see a physician, and the key differences between an athlete and an average person. We did get a question from our audience that I'm going to ask. This is from Rebecca, and I'll direct this toward Dr. Sedgley. She's asking about fatigue and heaviness in her hamstring. She says, what causes fatigue and heaviness in hamstring when running? My legs tend to feel heavy to the point where I struggle running. Any thoughts for her?
Yeah, thank you so much for the question. Appreciate it, Rebecca. I'm sorry you're having that issue. When we look at heaviness in lower extremities, especially in running athletes, we build what's called a differential diagnosis, or things it could be. And obviously not giving individual medical advice here, but in general, with heaviness, we ask ourselves, is there an injury in the recent past? Could we be dealing with a strained muscle? If there is, obviously that treatment is a period of rest and modification and physical therapy. If it's not a recent injury, sometimes heaviness can actually be something from higher up. I've had people with bulging discs in their back that will shoot, instead of a sciatic pain, they'll get a heaviness into their leg. Exertional leg pain is kind of a fascinating topic, at least for me, because I'm a nerd with running and I love this stuff. But I will look at, could there be vascular issues? We've found blood clots in patients. My general sense is, however, I like to look at what I call, how would your mom advise you or your parents advise you on your athletic endeavors to maximize your performance or avoid, leg heaviness? How's your hydration? Are you staying properly hydrated? Because that's crucial, as you're doing it, because that can lead to fatigue and reduced, physical capabilities. How's your sleep? We know that there's great evidence for sufficient high quality sleep that allows you to have proper recovery and then muscle repair, and then actually building up your energy levels for working out during training and competition. How's the nutrition? We see a lot of athletes, what is called REDS, REDS. This would be a relative energy deficiency. So they're not getting a balanced diet with the right mix of carbohydrates for energy, protein for muscle repair, and healthy fats to fuel that peak performance. And then just, time, sometimes they're running so much that they're not giving a good rest day. I always love to tell my runners that if they can get 2 days a week for strength and flexibility training, they're probably not going to see me as much because they're going to build up that muscle. They'll get more power for the hamstrings. And then stretching, obviously, I know it's kind of controversial, but I love having a dynamic warm up before you run and a static one after, and avoiding the good old ballistic stretches that they taught me in the 1980s where you keep going like this. And those can target muscle groups, to have a little bit more flexibility, which in general may help the feeling of, the hamstring symptoms you're having. I work very closely with athletic trainers and physical therapists. And one of the nice things we will use for a running athlete is actually doing a video gain analysis. Occasionally we'll find, range of motion is off on one side. Occasionally we'll find previous injuries are still affecting folks with weakness or atrophy. It's kind of nice. They have 2 high-speed cameras at 90 degrees, and they can find if there's imbalances in the actual gait of you running. So I know I threw a bunch of ideas your way, as we build a differential diagnosis, and I'm sure someone we can get you in to see at MedStar Health if we need to help you. But those are some things I want people to think about if they have similar problems. Hopefully that's helpful to you, Rebecca.
Thank you so much. And
I can actually add a little bit onto
Yeah.
this. One test that we offer for a lot of our athletes is a cardiopulmonary exercise test. And this is a really valuable test. As I was mentioning previously, I think about the body in sort of 3 main systems: the lungs, the heart, and then the muscles, when we're thinking about activity and sport. And the cardiopulmonary exercise test is really able to tease out each system while you're exercising to determine, if there's any abnormalities. One thing that can be really helpful, in particular to this question, is in a cardiopulmonary exercise test, you can determine someone's VO2. Their ventilatory threshold basically is the point that they're crossing over from aerobic activity to anaerobic activity. And if you're thinking about endurance medicine, endurance activity, we like to tell people to do most of their training below their anaerobic, anaerobic threshold. And that really can be a helpful way to sort of guide our athletes to sort of avoid, those heavy legs, that lactic acid buildup, so they can actually improve their baseline level of cardiac efficiency.
All right. Thank you very much for adding on to that. I have another question from our audience. This is from Tawny. I'll direct this to you, Dr. Grant. What is a heart healthy diet for a male with high blood pressure and a family history of heart problems who is working out to convert fat into muscle?
That is an awesome question. I'm doing the same thing. A heart healthy, there's a lot of nutritional science is a challenge, to be honest. If you look at a lot of, and it can be confusing, for people just sort of trying to take in all this information. Every time you turn around, there's, correlation studies, and you should eat this, or you shouldn't eat this, or coffee is bad, or, wine is good. You should, and it can be a challenge to really sort of piece it together. It's a lot of different diets out there. There's keto, there's all these certain things, but what's sort of tried and true, and as a cardiologist, the only real diet that we really recommend to people is the Mediterranean diet for specifically heart healthy, and longevity goals, and specifically for the Mediterranean diet, it's, healthy fats, it's things like salmon, it's things like avocado, it's things like extra virgin olive oil, it's lots and lots and lots of leafy green vegetables. It's kind of limiting your carbs, limiting your sweets, limiting alcohol, that sort of thing. Me personally, as a sports cardiologist, cardiologist, I always tell people everything in moderation, even moderation in moderation. So, you know, your little cheat day, you know, probably is not going to harm you too much and might be good for your mental health there too. But really, you know, the tried and true diet that we recommend to people is the Mediterranean diet. You know, certainly, you know, if you're a really active person and you're doing a lot of activity, you might need to, you know, increase your calorie intake to be able to give you the amount of energy to do the activity that you want to do. And then certainly, you know, having a focus on hydration, not just with water, but also with electrolyte replacement as well too, is really, really perfect for, you know, cardiac performance.
So what you're saying, Dr. Grant, is I can eat all the dark chocolate I want.
If it makes you happy, moderation and moderation, go for it, Dr. Sedgley.
In moderation, right? Well, thank you very much for the question, Tawny. Appreciate it. And if you have any other questions for our experts, please ask them in the comments. I have some questions for you now around the value of seeing a specialist. We've already touched on this, and I see lots of value from both an athlete and an average person who is looking to exercise. So it sounds like there's value not just from the sports medicine side, but also from a cardiovascular perspective. So, Dr. Sedgley, I'll start with you. Can you talk a bit more about how you understand what athletes are going through from all those levels and based on where they are in their journey, their age? Can you talk about your experiences with your patients and how you understand what they're going through?
So, you know, I think my perspective is maybe a more sympathetic one. When I was in my late 20s, I had played a lot of basketball. You can't tell on the Facebook Live, you know, Zoom, whatever, we're in the Brady Bunch, you know, pictures, but I'm like 6'8", pretty tall guy. I'm a pretty large guy. And I had been doing a lot of sports. I ended up having a foot and ankle surgery. And like the guy was like, well, the good news is we fixed your issue, but you should never run again. And I was like, you know what, that sounds like a horrible idea. But, you know, I was listening and everything worked out okay. For about 3 years, I didn't run. And then I randomly decided to run again. And I slowly got back into it, ran an 8K and did a whole bunch of 5Ks and lost 50 pounds, which I needed to lose. And then, you know, slowly got into the sport enough that I was probably running 30 to 50 miles a week, depending on which, you know, I had these various training plans, and got to doing, you know, triathlon through some friends who had gotten, you know, injured as well. And they were like, let's try this sport. And it became this thing where I'd gone from, you know, being told not to run to doing a fair bit of running. I think I ended up doing like 14, you know, triathlons and 5 half marathons and countless 5Ks. And so I had gone from being inactive to active. And so it was nice trying to find a way, because my typical sports, I had done volleyball, basketball, and, you know, being my height, I found a way to be active. And I think that is sometimes one of the most important questions that always ends the conversation. Like, oh, you know, Karen, you've got a stress fracture, or you've torn your meniscus, or whatever your injury is. And people want to know what that is. You know, we obviously want to describe the problem and what the plan is, but kind of lurking in that background is like, when can I get back to dance or running or, you know, soccer, lacrosse? You know, that's who I am. That's my identity. And I think as sports doctors, we have to be very mindful that when we're telling people to rest for a few weeks, we're actually like attacking their identity. This is like who they are. It's a very big deal. And so you can't just be like, don't do anything. Many times there are things you can do. It may not be the primary activity you choose while you have, say, a stress fracture. Maybe you're going to swim more. Maybe you'll be doing upper body lift. But I think we owe it to our patients. And again, this is something I wish I had earlier, to have a physician that's, you know, a primary care sports doctor like myself, or a sports cardiologist like Dr. Grant, who hears, you know, hey, I have a concern, but how do I get back to being who I am? Right? There is a need to participate. And certainly I think we see that joy, especially with young kids who maybe didn't get to play during the pandemic. Now they can be with their friends. And if they get an injury, what does that mean? Well, you're almost putting them back 2 years or 4 years ago. And that can be devastating, right? So you want to keep them with their friendship group. You want to keep them active. You know, their identity as an athlete. And so, you know, when people hear, hey, don't do X or Y because you're injured, that may be valid, advice, I think it is on us to really realize we need to go a little bit further and give them some options so they can continue to be who they are.
Matt, I think you really sort of nailed it when you talked about the word identity, to be honest. And I'll share this reflection that I had. Earlier this year, I saw a 70-year-old gentleman who had been a swimmer his whole life, high-level swimmer. He grew up in a pool, swam in college, even got the opportunity to go to the Olympics, later in his adult life. So awesome swimmer, swam in his 40s, 50s, really sort of enjoyed it. I saw him as a secondary opinion because he saw one of his general cardiologists and they took him out the water. They said, because of your cardiovascular disease, it's not safe for you to continue swimming at this level. And this guy, he's retired, he's got his grandkids, you think he had everything sort of going for him, but you took him out of the water and he was depressed. And so we recognize that, as athletes, that's, a lot of how we get value out of the lives that we're living. And we get so much joy from being able to compete and from being able to do the sport that we love so much. We were able to do advanced testing with him, and he did truly have cardiovascular disease. However, we were able to manage it in a way that allowed him to compete, at that really high level. And he was able to get back in the water and do what he truly loved to do. And for me, that's what it's all about, giving people the space and the opportunity to do what they love to do for as long as possible.
Yes, that is. Thank you so much. Let's talk about, you mentioned cardiologists. Let's talk about the difference between a sports cardiologist and a general cardiologist. Can you explain how testing is different between an average person to ensure normal heart function and how it differs from an athlete's testing? And what does a typical appointment look like?
Yeah, so, general cardiology, it's a beautiful field. I'm a general cardiologist myself, but after my general cardiology training, I spent a year in Boston at the Massachusetts General Hospital at the Cardiovascular Performance Program, getting the opportunity to learn how to take care of high-level athletes. And so in that year, I learned all the tips and tricks, worked with most of the, Boston professional teams, worked with most of the, Boston sort of collegiate circuit as well, and sort of learned, what it looks like when someone commits themselves to athletics. What does that change due to the heart function, heart capacity, and then the imaging of the heart? And so I brought that practice here with me down to MedStar. And so there's lots of differences between an athletic heart from sort of a non-active human's heart. You really need sort of a trained eye to be able to look at and tease out some of these differences that can come about. We have lots of different testing that's available to us. I mentioned the cardiopulmonary exercise test. That's a really great test. Oftentimes if you go to a general cardiologist office, they might put you on a treadmill and they might run you a bit. But if you're a high level, let's say marathoner, that stress test protocol that they put you on, that's not even going to come close to getting you to, your peak cardiovascular performance. And so, at MedStar, we have a beautiful cardiopulmonary exercise lab. We have a high level Woodway treadmill. We even have raised the roof. So if we had Matt Sedgley at 6'8" that wanted to come get on our treadmill, you could come, not worrying about bumping your head. But we will really, put you, on a sort of idiosyncratic stress protocol where we can, use your level of fitness to ensure that we are getting to that maximal level of capacity. And in that, like I was saying, we're able to define your ventilatory thresholds, your VO2, your aerobic, your anaerobic metabolism. We give a lot of information to our patients that can help guide their training going forward. Beyond that, we have a cadre of imaging modalities too that can really sort of help look at the heart. We have wonderful, ultrasound technologists here that can take pictures of the heart. We have special protocols for our athletes. We have cardiac CT, we have cardiac MRI. We can look at the heart rhythm. We can put monitors on our patients to really sort of look at and be able to see every heartbeat that they're having, over a certain period of time to be able to hone in on specific, characteristics of that athlete's heart. A typical patient visit, you might come to see me, you'll get an EKG, we'll chat for a bit. Then, depending on what the actual concern is, we might plan for a cardiopulmonary exercise test. We might plan for, perhaps blood work, maybe some cardiac imaging, and then we'll circle back once we have all of this information put together to really sort of create a plan for that athlete to be able to perform at their highest ability.
All right. Thank you so much. Now that we have all this wonderful information about the differences between an athlete's heart, average person's heart, when we see a specialist, what to keep an eye out for. I want to talk about some thoughts during an event. Let's start with you, Dr. Sedgley. When you're preparing for an event, should you make people aware of your medical history? For example, if you are running in a race, should you put your medical history on the back of your race bib? Should you let your coach know? If you're starting a sport, what advice would you have for our viewers out there who are preparing for an event?
Yeah, I think that's a good question. I mean, most of us probably don't think about these kind of problems in advance. However, if you've seen Dr. Grant and he tells you, hey, you have atrial fibrillation, or the heart doesn't beat regularly, or maybe you've had a heart attack and you're back at running, or you've had a stroke and now you're actively doing some sports. And the most common thing I work with as the director of running medicine for MedStar Health is races. And so they give you a bib with a number, and I think the easiest thing to do is write your medicines on the back and any allergies on the back with your condition. That's pretty straightforward. Having done a lot of racers and sweat a lot, sometimes that will become illegible. So that's always kind of a concern. There are products out there that many people use. On my watch, for less than $10, you can get things that put an ID. Can say, hey, Dr. Sedgley has high blood pressure. He's got these medicines, these allergies. Here's his wife's phone number or spouse or partner's direct line. Like if you find them down, this would be who you want to call after 911. So there are ways you can communicate your medical needs if you have special needs there. There are, in the larger events that MedStar covers, usually a software app that if you choose to, you can actually put an extensive medical history. And if you're brought into our finish line tent, we will look at your bib, and we actually it's encrypted, it's HIPAA compliant, it's just like an EMR. You can look and see what that is, which is very nice because there are things we can't tell when you are unconscious. And so we can get that information and make some big differences in the first 5 or 10 minutes taking care of folks. So there'd be examples of having a medical history. You want to share that. I don't think you're under any obligation to do that. And certainly, if you do so, it may help. If you have a coach like you're talking about, you can certainly tell them if they can advocate for you. Or let's say your sport's not a marathon. Maybe you're doing lacrosse, or you're traveling to a showcase. Having your parents there or friends' parents, they could ask for your medical information in advance. I work very closely at a lot of the schools, MedStar staffs with athletic trainers. These are experts in sideline medicine. And they probably know more about the athletes sometimes than I do. So when someone goes down during soccer or a lacrosse game or something on the field, I usually just kind of stand there and I wait to see if the athletic trainer is going to raise their hand and say, I need your help, because I don't want to rush out there if they've got it. But occasionally there'll be something that bad happens, heart attack, or they're hit in the chest with a lacrosse ball, their heart stops, and those are things where we'll activate an emergency action plan to rescue that person from their condition. So I think you have options to share information, and some of those can be done before a practice, before a tournament, before a season with your athletic trainer. Sharing that information. Typically, I'll be honest, most coaches in my world don't have the medical information because their expertise is the offense, the defense, and they're usually not the medical team. But it just varies on your scenario, and it may be appropriate in some cases. I'll tell you, most of the coaches of my really good softball players right now are their dads. So you find a way to get that information where it's needed.
That was really great, Matt. And the one thing that I will add on top of that too, when you're thinking about performance, you're thinking about race day, game day, et cetera. One thing that I always am harping on is making sure that you're having adequate sort of, where it's race day, it's race hygiene. If it's, your whatever performance is good hygiene. So that is a proper warm up, that's making sure you're hydrated appropriately. If you are doing any sort of endurance exercise, you're getting in your fluids, during the race, 500, 600, 700 milliliters of fluid every couple hours where you're running. If, you are doing a marathon type, you want to make sure you're repleting yourself with carbohydrates while you're doing the race, and sort of really being intentional about making sure you're maintaining, that preparation and that nutrition, even while you're actually performing the activity. I mean, because you can see injury, during races and even during sport. And, Dr. Sedgley, you brought up a really great point about emergency action plans. And that's things that we do, as clinicians, as a sports cardiologist, as a primary care sports medicine doc, we think a lot about, what potentially could go wrong here. And, how can we treat that or manage that if it does happen to go wrong. I think, a high volume scenario that most people saw was on Monday Night Football when Damar Hamlin went down. And while that was terrifying and scary to see, what you saw was a really sort of beautiful concerted effort by the medical staff to resuscitate that human. So much so that he's back in the NFL. He's doing what he loves to do. And that, to me, is the beautiful thing about sports medicine. Something bad can happen. His heart stopped on the field, but with the support of the team and the community, he's back and doing what he loves. Those are the things, those are the wins, that I take, that, Dr. Sedgley takes, that makes, the work that we're doing really, really important. One thing that I will give, to the audience that I think is really valuable, while we certainly create and practice our emergency action plans, it can be really helpful if you know CPR. And so, if you happen to be a coach of, a little league team or a high school team, getting an understanding of how to use an automated defibrillator device, getting an understanding of how to do good quality compressions could be really helpful. You never know when that skill set could come into play and could potentially save a life. I mean, we've seen on national TV how valuable those skills are. And I just think it's good knowledge for everyone to have.
Great. Thank you so much. And you talked about hydration. Can you talk about what's the best way to manage getting the proper levels of potassium, salt, and other nutrients while you're getting hydrated? And what is hypotremia?
Oh, hyponatremia. Yeah.
Hypoatremia. Thank you.
So real quick, we could put your audience to sleep with all the data we have on the kidney and the heart. I'm gonna keep it real simple. If you are, say, an athlete and you are thirsty, I want you to drink.
Yep.
That's
Okay.
it. Now,
that.
now the reason is back in the 1970s and 80s when I was an athlete and you guys parents were athletes. Basically, like not a lot of people had trouble with hydration, but then there were some advertisements that said, hey, get ahead of hydration, drink a lot, drink a ton, drink more. And then we saw people get hyponatremia, which is a condition where you drink too much water. You actually get water toxic and you diluted the amount of salt in your body. Interestingly, when this happens slowly, your body can kind of react to it okay. It's more common in elderly individuals. But rapid pushing down of the salt level in your body through aggressive hydration or overly aggressive hyperhydration, it's a problem because it actually can make your brain swell, and that's not compatible with life. You can actually have seizures, coma, and death. This Monday, 3 days ago, I worked the Boston Marathon. The second to last runner came in and unfortunately had been running for about 6 hours, and it's estimated they had drank, probably like 2 or 3 liters. It was just too much water, and they were, at risk for seizures. So, and we see this a lot in endurance medicine because you're running for long periods of time, and maybe you're a novice runner at a long distance, and you see the water table, and you're like, I'm going to take some water. Really, we want people to drink when they're thirsty. I will tell you, as people get to that more sub-elite and elite level of, say, running or performance, we will actually figure out individual hydration plans for folks. And it goes beyond just the drinking for thirst. Like, I know if I'm running a half marathon, I want my spouse and partner to be at mile 6 with some salty vinegar and salt chips. And not only do I love the taste, but I will actually cramp if I don't get that salt. And normally, Dr. Grant would say, no, Dr. Sedgley, you have hypertension. You shouldn't be eating too much salt. But I've just run 6 miles and I'm about to run, a little bit more than 6 again. for me, I've dialed in my nutrition and my hydration to a plan where I'm not dehydrated, I'm not overhydrated, but I've also got the electrolytes I need. Because a lot of sports drinks actually are kind of low in salt. Human blood is the same salinity as salt water. So when you go to Ocean City and you swim and the wave hits you and the water goes in your mouth and you're like, yuck, you'd have to have a sports drink that tastes like the seawater to have the equal amount of salt. No one's going to drink that willingly. So it's a delicate balance. And certainly elite athletes who I've had people run for 6 or 7 days straight, they're dialed in. So they're eating very salty, like pepperoni pizza when they're getting their break. And then they just keep going. I think hyponatremia is one of those things where we see usually in typically slower runners who drank a lot, might have taken too much ibuprofen because it seems to affect it. It's more common in female athletes. So we don't know why. Sometimes we're not as smart as we look on Facebook Live, but if you're drinking to thirst, 9 times out of 10 you're going to be safe, and that's our recommendation.
Thank you so much. That was really helpful. We covered a lot today. To wrap things up, I'd love to hear if you both shared any experiences at an event or a shared patient where you could share, recount that story.
Well, I don't have a patient to say right off top, but I think the one thing that I want to leave people with, as you look at the data, you look at the population, you look at the United States, cardiovascular disease is the #1 killer of people just globally in our social setting. And to me, I don't take that lightly. But if you look at cardiovascular disease as a whole, we recognize that people who are fitter, people who engage in endurance activity, people who are doing at least 150 to 200 minutes per week, they tend to live a lot longer. And we can manage some of the cardiovascular disease that can happen, when you are an active person. But, a baseline level of high VO2, of high fitness, of high cardiovascular efficiency goes a long way to preventing cardiovascular disease. How I think about it and how I talk to my patients is exercise is the same thing as medicine. For people that do take, maybe perhaps a blood pressure pill every day or maybe a cholesterol medication every day, I think of, a dose of exercise, a 30-minute running session or, low intensity steady state exercise session, just, in the same benefit that, you can get from, those pharmacotherapies. So exercise in itself, sport in itself is so good for the body. And I just encourage everyone to get involved.
Thank you very much. Dr. Sedgley, an experience or final thought before we wrap up?
Yeah, so I have permission for this one. We actually have medical runners who are in most of our races. And one of our med students, Dr. Hines, who's now going to be a sports physiatrist when she grows up, she was running the race and actually found someone with heat stroke, brought them into the finish line tent. We actually saved their life. That person turned out to be the daughter of an Olympic athlete and nurse. And now that person who we resuscitated actually runs as a medical runner. So it's a great community. I wanted to say that, I love activity. And if you're out there, it's never too late. I don't care if you're like me, slightly overweight, older, there is a way to be not lonely, and that is coming out and participating. Feel free to go to your local shoe store. The entry level for a lot of these sports is low cost. And I think that, I'd love to see you guys at any one of the events that MedStar Health sponsors. We have the Baltimore Women's Classic coming up. It raises money for the House of Ruth. Love to see people out there. We have 5Ks, 10Ks, half, full marathons. Get out there. You'll be running next to cancer survivors. If you're slower like me, you'll be with folks who are like twice your age. It doesn't matter. You'll be out there doing good for yourself and the community. And that's why we love what we do. So we'd love to see you soon.
That is a great takeaway. Thank you so much. Well, that wraps up our broadcast. Thank you to our viewers for tuning in and asking questions. And of course, thank you, Dr. Grant and Dr. Sedgley, for joining us to discuss this important topic. Dr. Sedgley sees patients in Frederick, Westminster, and Ellicott City. To schedule an evaluation with Dr. Sedgley, you can call 877-34-ORTHO. And Dr. Grant sees patients in Baltimore and Washington, D.C. To schedule an appointment with Dr. Grant at MedStar U Memorial Hospital in Baltimore, you can call 410-366-5600, or to schedule an appointment at MedStar Health at Lafayette Center in DC, you can call 202-416-2000, option 1. We will post this in the comments as well, so you can have it. Thank you again for joining us. We appreciate the time.
Thank you so much. Thank you. Bye.
Thanks, guys. Have a great day.
You too.